Hey guys, it's Dr. Angelina with SurgiCare Arts and here, and I do my institute. We are starting a series on our YouTube where I will be meeting with some of the people that I work with. This time it will be Natasha Welch from Arbraza Skin Studio. She is an esthetician as well as nurse practitioner, and she has her own studio, and we do collaborate a lot. And we're going to start meeting up and talking about different things. And of course, we always welcome input and requests for more information or suggestions. And here we are today at my office in Atlanta, in Ideal Body Institute office, talking about Morpheus8. As always, please subscribe, push that button on your YouTube control, and like all our videos. Hello.
Hi everybody.
Let's introduce ourselves. It's our first video.
Yes. Hey, I'm Dr. Natasha Welch, nurse practitioner with Arbraza Skin Studio, and I'm having the pleasure to be here with the amazing
Dr. Angelina Postoev. I'll just go by Dr. Angelina for the TV purposes. And I am a triple board certified cosmetic surgeon and general surgeon, critical care surgery, but right now cosmetic surgeon. And I'm here with Natasha.
Hola.
And my practice name is SurgiCare Arts and Aesthetics and Ideal Body Institute.
Yeah. Well, I'm excited.
Me too.
You have a toy today.
I have toy.
Yes.
I have toys.
Lots of toys.
I have lots of toys. Today we're going to talk about one toy. So it's our first video. We're going to do series of many videos and many different toys. And I think if we're doing it on YouTube, you guys can write to us and tell us what else you want to hear about.
Oh yeah.
And we can talk about it.
Yeah, absolutely. Listen, I'm pretty excited. If you know me, you know my big thing is skincare, skin, face care. But listen, there's more than you can do in terms of products, facials, even fillers, is that safe to say, and Botox, you can do for your face in terms of tightening and skin rejuvenation. So I'm really excited to talk about this.
Right. So we're going to talk today about Morpheus8. It's radio frequency microneedling. And if you follow Natasha, you know she does a lot of microneedling. She does a lot of PRP microneedling, a lot of what else you do? Vitamins, stem cell, different brightening.
Yeah.
And we do that too, but this is basically takes it to a next level. So different devices will go to different depths. So when we talk about microneedling, we're talking about the type of instrument we're using, the depth of penetration of the little needles, and then what we use with it. So PRP will add extra oomph, right? Extra healing, extra stimulation of collagen elastin. This toy called Morpheus8 will add extra radio frequency energy. So it's bipolar energy that will get delivered with those little needles. So if I bring this closer and I push this pedal, you can see those needles coming out.
Wow.
Can you see it on this camera right here? There we go. You see them? The little gold needles right there. So these needles will get to different depths, and when I do the procedure, I don't just go to one depth. I will do it on multi-depth level. So we'll deliver energy at 2 millimeters, 3 millimeters, 4 millimeters, obviously depends on body part. And we'll do it several times, and that will shrink the tissues. It will deliver enough heat to kill bacteria, to shrink the tissues, and then continue to kind of improve collagen elasticity, and again, takes it to the next level.
Oh, wow. So it's going deep into the dermis.
It goes in the 4 millimeter depth, it actually goes past the dermis in some places.
Wow.
So I've had some pictures where I've done it on this area, submental area, with somebody who had a little extra pooch here and they didn't like it. And instead of injecting Kybella or doing liposuction, for select cases, we can tighten that up with this device alone.
I'm going to have to get that.
You don't have a pooch?
I don't have the Kybella, but sometimes I see something coming.
Right, and it's for that. So we see that little bit
coming.
of that skin. It's trying, when you look at the Zoom meeting right now, and you're like, I'm seeing something's happening right here, that device will help you shrink the skin. To tighten those lines.
I need that.
So what you're doing, you're making your skin healthy. You're getting the scars to lose the discoloration, right? This actually takes those textural changes, the deep lines, and making them lighter. And then we can also do active acne.
Ooh.
Because your PRP usually don't do it on active acne.
Absolutely not.
You do it for post-acne,
correct,
inflammatory scar and pigmentation. This can work on active acne.
So let's talk about that. Because I have clients, I'm thinking right now, that have very active, like stage 3, stage 4, like, you know, that cystic acne.
Cystic acne, the
and
painful
they
type.
are Fitzpatrick 4 to 6. So that's not really a laser candidate for acne treatment because of the skin type, with,
right,
with the device I have.
Right.
So this would be safe?
Absolutely, it's colorblind.
Ah, love it.
It's safe for any skin color.
It. So the mechanism is this antimicrobial activity of the heat. Am I right?
Correct. Basically, the energy, the heat will zap those bugs.
Wow. And at the same time, help with resurfacing.
Yes.
Oh, that's a must.
Yeah.
That's a must.
So then we control acne with this, and they can go back to you to continue their, you know, if there's any more pigmentation left, you know, PRP, we can do them on a regular basis, right?
Oh, I love it.
We always recommend all those facial stimulation on regular basis, but that can zap active acne as well.
So there's no real cure for acne, I like to tell people. No. Sometimes it's like keeping the lid on a boiling pot. So like how often should they get this, or is dependent?
It's dependent.
Okay.
I always start everybody, again, depends on severity, but I'll start package of 3.
All the time. I say it all the time.
We'll start package of 3. We do them 1 month apart, and we'll see how far we get. If it's getting better, but maybe not quite there, we can repeat another session. Or maybe wait for a few months, just continue with skincare, maybe some filler for the ice pick scars, or some people will do peels, right? To kind of continue the care, and then come back a little later, maybe half a year later, 9 months later, do another set.
I love that option. I mean, that's a winner. I'm thinking of several clients that need to come in here. And I'm even thinking, you know, I'm always thinking like, how could I fit that in? And like you said, you can do this 1 month, maybe do your facial the next month, and then and you know what? I have so many clients that really hate. I had a discussion today with someone on a virtual consultation that hates taking spironolactone.
Right.
You know, like, I just want it out of my system. I want to get pregnant. You know, I get that a lot. And they want to come off of these medications. I'm tired of clindamycin. It doesn't work. I'm tired of this. I'm tired of that. So that's good to know that is an option.
That can definitely help to control acne.
What other parts of the face?
I can treat with the machine. I can literally treat every part of the body.
Awesome.
Even the things that I probably shouldn't mention on this video, but I used to be a colorectal surgeon. Literally every hole.
Whoa, let's talk about holes.
Let's talk about holes.
Let's talk about holes. So what will it do for the hole? Hey, people have holes. They want to know.
So the most common procedure you hear about, actually this particular platform, which I'm using right now to show, Votiva machine, is made for vaginal rejuvenation and feminine rejuvenation. So the common procedures that we do will be Votiva, which is transvaginal rejuvenation, using slightly different device, not microneedling, but we include microneedling in the resurfacing of outer vulva, which is the labia. That's Votiva. And then Aviva Femtide, in my world it's also called Fupotide.
I love it.
I know, right? I use words that people understand.
Yes.
And non-surgical labiaplasty, tightening of mons pubis, which is vulva, external labia, majora and minora. And it's a combination of Accutite, which is that procedure that goes under the body tight, face tight, that procedure. And then on top, we use that Morpheus to tighten everything up, to give everything nice, smooth appearance. The non-wrinkly, you know, take it 20 years back appearance.
That's another video. I'm gonna.
That's a whole another video.
I'm saving that for the other video.
And then the other hole too.
And the other hole.
To make it function better for people who somehow made it dysfunctional.
So see, you can get tightening
everywhere.
Tighten it all up. Ooh, I know clients that would love that.
Yeah, I know a lot of clients that love that.
I know a lot of clients that would love that.
And very happy. Improvement in different kind of functions, sexual functions.
We want to improve sexual function all day. You know, okay, that's the other video. So let's get back. Skin.
So skin, microneedling, acne, discolorations, post-acne inflammation, melasma, scarring. Melasma, it's as we know, no treatment for melasma really. I mean, we can do all kind of different things. We talked about pico laser with you.
Correct. How can it help?
It can help
with the melasma.
It's just the same thing. It helps to just lighten out the skin, and a lot of times we'll add PRP to it as well.
And again, colorblind.
It's colorblind.
Okay, because a lot of my melasma clients may be of different ethnicities, and they're
Absolutely.
always told, no, we can't do this.
We cannot do CO2 laser. We cannot do certain surfaces like erbium lasers. But now we have this toy that, well, I've had it for a while. I've had it for a couple of years. But it really works great.
I love it. Chest,
skin right here that everybody always forgets about. This stuff that gives away your age, right? We do the face, and then we forget like here, but it's still showing, and we forget to put SPF here, so we get the discoloration from the sun, freckles, wrinkles between your boobs. We can do this, and it will definitely brighten it out. It will brighten out the freckles. It will take out that little pigmenty wrinkles, crepiness, textural changes. And I love to use it as maintenance. So any kind of skin condition, scarring, even if somebody had facelift or face tight procedure, and then they're like, well, what happens next? I'm like, well, we have to continue to maintain it.
Absolutely.
This is maintenance.
Because we don't stop the clock. Right. The clock is still ticking.
Gravity's still there.
Yes, gravity is still there.
We didn't find the anti-gravity
we haven't found
generators yet.
But we have something that can help. I can't wait. I'm thinking about myself. Crow's feet.
It will help. I just did mine. I posted the video of me doing my life. You've seen that one, me doing myself. I don't do Botox around my eyes.
Me neither.
I only do Botox on my, regular face.
Yeah.
So.
That's great.
Oh, well, I did the video of me doing Botox on my neck.
I'm next to you. I know.
So I do have some, but
Bands. But you just did it.
But I haven't done, it takes 30 days to see results, but a lot of times you'll start seeing certain changes sooner.
Sure.
Like I zapped my acne. I had little cystic acne coming up over here. I zapped that's dried out.
Oh, I love it.
So one of those things, and if it's a little area, we can just zap little area.
If it's acne, it's a must. You gotta fit this in. This is all about just self-care and wellness. I keep saying there's no excuses.
Right.
Yeah, just do it. All right, what else? Oh, I want you to mention this.
Armpits. You can do your armpits with this. So you've heard of people doing Botox for armpits to minimize sweating. And usually you have to repeat it every 6 to 9 months with Botox.
Yes.
This one, it depends on the severity of sweating. If somebody who really doesn't sweat, sweat like a regular person, not extreme, not pathological, but you don't want to wear deodorant. Maybe you have a reaction to deodorant, all the chemicals in it. For me, I'm just lazy.
I just don't want to wear deodorant.
I just don't want deodorant. I'm just lazy. And then it messes up your dresses, right? Because then the dry cleaner doesn't get it out.
Yeah.
And then you have the cakey stuff on it. So I hate that. So I started doing that with my older device, but same thing basically. And I tend to repeat it once a year, maybe. Like first time I went for about 12 to almost 15 months maybe without doing anything, without wearing deodorant. I can go work out to my Pure Bar and then go to work.
I love it.
And not wear deodorant.
That's what I'm
And then I repeated it again, I said about 15 months later, and like
one treatment and you didn't have to wear deodorant?
For about a year.
I'm sorry.
But I'm not hyperhidrosis, I'm just like a regular person. Like if there's a hyperhidrosis,
package.
You have to look at exactly how severe is it, which stage of hyperhidrosis are you.
Absolutely.
Then we have to make a package.
Absolutely.
But you're sitting next to me. How am I? Stinky?
No, never.
Not stinky.
You're never stinky.
I'm not stinky.
Yes, I'm getting that.
But I've been here.
All over.
It's 6 p.m. I've been here since like what? 8 a.m.
I want everything.
I'm okay.
I'm getting this. I'm gonna redo my scars.
We can definitely try to help to resurface.
This time. I'm doing this. I'm sending all the acne people over here. Fupa. Everyone comes to see me has a fupa.
You say fupa, I say
fupa. Am I saying it right? Fupa.
Do you know what it stands for?
Yes. Is it fat under
upper?
Yes.
Female area.
Yeah, I do. I worked in a cath lab.
Trump said it, can I?
Yes. My docs had to go through fupas to introduce angiocaths. So yes, I know what they are. We've taped them back before, matter of fact. So yes. So, okay, I love
So
it.
it can tighten it.
I love it. See, there it is. See, I'm so excited. I'm really excited to be doing this with you.
So, people, follow our channels on YouTube.
Yes.
Ideal Body Institute here and Abraza Skin.
Abraza Skin Studio and Abraza Skincare. Hey, follow my skincare page. It's a little lonely over there. But Abraza Skin Studio. Yes.
And ORI OR Skincare, which doesn't have a page, it will have a shop.
Page coming. But definitely shop is here.
Shop is coming.
Shop is here. And we're both in the Buckhead neighborhood here in Atlanta.
Yep.
Yes.
So.
All right. Oh, wait. Your other beautiful location in Loganville.
Right. So my main location is in Loganville, 19,000 square foot facility.
It's gorgeous, y'all.
And then now we're in our Buckhead office, which is right there next to the shops. So easy to find, not far from your office.
Yep,
so patients can hop around between the two offices. Just go to her, come to me, do this with me, Morpheus, and then a couple weeks later can go back to you to do your hydrofacial.
Absolutely.
With me, my patients get the Diamond Glow, which is very similar to hydrofacial.
Yes.
So, but you can follow that up. So you can do this and then get all that dead skin off with the hydrofacial type of machine, microdermabrasion treatment.
I'm loving it. See, women, we can work together.
Yeah. I love Natasha.